Welcome to Blue Line Mental Health. I'm glad you're here. If you haven't already, please take a moment to click that like button and subscribe to our channel. And don't forget to hit the bell notification so you don't miss any of our new content we share. Warning: this channel may contain material that is graphic and could potentially be a trigger for some. Viewer discretion is advised. Don't say I didn't warn you. In this video, I'm honored to be joined by the Chief of Wauwatosa, James MacGILLIS, to discuss the mental health challenges law enforcement officers face amidst the increasing community stressors over the last decade. We'll explore strategies for resilience and support within the force and the community. Let's dive in.
I've been in this profession, I'm in my 30th year, and when I first started, it wasn't really talked about. Not a fun statistic to talk about, but in my tenure, lost 4 officers in the line of duty that I knew, that I had a relationship or knew them. Conversely, I've seen 13 officers take their own life in that same time frame. Good news is that we're asking questions, we're engaging in dialogue, we're recognizing that we need to talk about that elephant in the room. Cops are people, they have feelings, they see some very ugly things. We have to recognize that and figure out how do we support them in that venue. Openly talking about the mental health of your officers, encouraging them versus having that stigma. It's okay to go talk to someone. It's okay to see a mental health professional wherever you are in your career because of the stressors involved in it. Whether you're a police chief or a police officer or a dispatcher, you're still exposed to that same trauma, just maybe different way of being exposed to it. Even clerical staff, they have to watch some of those body-worn camera videos for like an open records request, or dispatchers who are at the other end of the radio hearing those things happening in real time and not having closure to it, or the police executive who has to go visit family members at a hospital when their loved one is dead or seriously injured. A lot of different stressors. We're talking about it. We're also figuring out what resources our cops and deputies need. Having peer support. Back when peer support probably wasn't the healthiest. It wasn't serving the needs of the people that needed that support. Well, if we develop a peer support group and a network involved with different people, volunteers, provide them some training, they're not social workers, they're there to bend an ear. Also utilizing faith. Generally, most people believe in something, some type of faith structure. The utilization of chaplaincy or faith services. Cops are more willing to talk to somebody if they know there's protections of confidentiality or even privilege. I can tell you that our legislature in Wisconsin recently passed a law recognizing that cops experience PTSD, post-traumatic stress disorder, or post-traumatic stress. They also recognize that peer support groups should have the same privilege as a chaplain. Once they have that training, what I tell you in confidence is also privileged. That's going to get cops talking. That's going to get cops getting the help that they need. That's a far cry from where we were back in 1995, and that gives me a lot of hope and excitement that that's how we get cops to the finish line. When I say finish line, is that they have a good career, that they're healthy, happy, and whole when they leave this profession and move on to something else. I also think that as a police chief, that's my job to support that and facilitate that. It can be a very bumpy road, though. Doesn't matter if you're a 5-person department or a 5,000-person department. Again, frequency, you're going to see some horrible things out there and have some horrible experiences, but you're also going to have some great experiences. Let's figure out ways that we can help our cops cope to get to that finish line. Well, cops are people, and they deal with home life stress, work life stress, bills, divorce, things with their kids. They deal with all of those things along with going to a traumatic accident, a car crash, or seeing a community member shot or even dying. The cops see a lot of things. They have things in their personal life, just like any other person out there, along with the added stressors of the things that they see out while they're on duty. That stuff starts to pile up. And again, they're human beings. And I don't say this as a braggart. I've seen cops struggle with alcohol. I've also seen them struggle with prescription drugs, prescription medication. I've also seen them struggle with illicit drugs too, understanding that cycle of addiction, how that can happen, of self-medication of yourself as a human being, whether through alcohol or taking prescription medication, and they end up spiraling out of control. It's recognizing that those things can happen, talking about it, interceding before those things happen. And if we know what to look for and what questions to ask, we can, again, help those law enforcement professionals make it to the finish line so they don't go down that rabbit hole in the cycle of addiction. Talking about suicide, again, looking for the signs in the workplace or through relationships or having a peer support network, being able to intercede before an officer starts to go down that rabbit hole. Because as human beings, we can go into some pretty dark places based off of the stressors that we see in our personal life and then the stressors that we see professionally. We're people that do a very unique and very rewarding, cool, interesting career, but that can take a toll. Well, the good news is I've already seen a lot of improvements. Peer support teams, peer support networks, recognizing that when an officer dies either from a medical condition or dies in the line of duty, we have to be there and be supportive. People call it the blue family. Well, you have your real family and you have your blue family. Real family comes first, but close second is the blue family. We have to recognize that there's two different groups of people there that want to be there and support. Providing better services. I've seen marked improvements on not just our onboarding, doing the psychological assessment, making sure it's the right person who does this profession, and having those conversations right when they're onboarding that destigmatizes the need for mental health support. You talk about resiliency. There's physical resiliency, being healthy physically, but then there's mental resiliency as well. Making sure that officers are aware of the services that are available, whether it's through employee assistance, whether it's through a mental health partner that a department or a municipality partners with. It's preparing them for becoming a detective, recognizing that they're going to be seeing things that they can deal with those type of stressors. I can't even imagine the stress involved being a detective dealing with internet crimes against children. The things that they get exposed to on a day-to-day basis that they have to investigate. And they may even have kids themselves. Making sure that they get mental health check-ins, or when they want to tap out and say, hey, I can't do this anymore. This is just, it's getting to be too much. Giving them the ability to not be okay with it, that they can step away from it, recognizing that they're people. I've seen a lot of improvements over my tenure in this profession, but there's still work to do. Partnerships with chaplaincy, talking to elected officials. Hey, we need monetary support to support the mental resiliency of our cops. Another thing that we haven't talked about is now you go from whatever you did before, and now you're in this profession where you're going to have maybe more money or benefits, and you're going to have a good, healthy, fun career, interesting profession. Financial planning. You're not going to do this for the rest of your life. So right from the get-go, start talking about that. Where are you investing your money? You need to have an exit strategy post-police career, making sure that those services are available. In fact, even bringing them into your department so they can meet a financial planner or a bank or a service that offers a deferred compensation program that would go along with a pension if that was part of a contract or part of what they had as a benefit. Is looking at it multifaceted. These are people that maybe need some support and guidance on how to cope, how to deal, how to prepare themselves for what a post-policing career looks like. If there's a finish line, you're not going to do this your whole life. Asking the questions, what do you need? Listening. One of my captains shared this phrase with me, and it rings so true: 2 ears and 1 mouth. We got 2 ears and 1 mouth for a reason. More listening versus talking. Hearing what their concerns are, what they need. At the department I work at, we have a peer support network. We had something before. We had the police officer support team partnership with the neighboring agencies, with several neighboring agencies. But we wanted to redirect or recalibrate based off of what we had heard as best practice, and there was the interest of our officers. But it has to be volunteer. You want to be part of peer support, right personality, right motivation for doing it. There's a captain on our peer support team, handles the administrative side of it, make sure that there's some balance between the day-to-day work and them as people, and then also what they do in peer support. But our team is led by a detective. She does a fabulous job. Has a lot of autonomy. Again, giving that authority to that team that if there is a critical incident, an officer-involved shooting, or something really traumatic, go do. Let me know what you need. Versus, no, you're not going to do that. Giving them that autonomy to lead. Again, leadership doesn't know a rank. It's giving them that authority, that autonomy to do those types of things. Obviously, it has to stay within the rules and the guidelines and the organizational mission, but if you give people the autonomy and support it, they're going to do some great things. And not great things that I might necessarily want. What our people need? There's a difference between the two. And if we look, it might actually be the same. It's hard to predict the future. You look at what hasn't been done or what has been done in a good way, or maybe not the best way, and tweak and adjust for future success. It gives me a lot of hope and optimism that we're engaging in those relationships and having that type of that conversation, whether it's a labor organization or whether it's a particular division or bureau or even organizationally, asking those questions. What do you need? How can I support that? Being honest, we may not be able to do that now, but we might be able to do that next year. But it's still on our strategic plan. We have it written down. That's something that we have as an area of focus. But also being honest as leaders, administrators. I'll give you an example. Doing mental health check-ins. Other agencies do it. I thought it was a good idea. We asked for some funding. And we did it. And we did it for about a year. We had about a year's worth of funding. We had it through a grant. And listening to the labor organization that said, you know what, boss, this is probably not what our people need. It may feel good for you, it may feel good for the common council or the community, but we have really good support systems here, whether it's through onboarding or whether that's the support bucket in the middle, or when we prepare people for a promotion. We're good. We know those services are there. I know they're using them because I see the confidential invoices, the indexed invoices that tells me they're using those services. That's my reassurance. That's the time for me to listen to my people, back off, and support them the way that they need to be supported versus what I think they need to be supported. That's, I think, a good thing. I think it also helps develop trust. But that may not be the right answer for other agencies out there. I think it's incumbent that as a chief or a sheriff or a supervisor, ask the question, is this serving the needs of this division or bureau or even the department? And if not, let's figure out a way to get them the support that they need. But then again, sometimes you also have to say, no, we can't do that. No, it's establishing those boundaries too.
It's clear that the brave men and women in law enforcement face immense challenges and traumas daily. Their service and dedication often comes at a personal cost, impacting their mental health in profound ways. It's imperative that we recognize their humanity and provide the resources they need to heal and thrive. Together, let's support our law enforcement officers by advocating for better mental health resources, ensuring they receive the care and compassion they deserve. Thank you for watching this video on our channel. If you found this content meaningful, please like, subscribe, and share to spread awareness and make a difference, one step at a time.